Hi, everyone. Just wanted to go over our work from week 5 and then go over a few quiz questions and move on to week 6. So last week we were still involved in the ethics realm and talking a little bit about autonomy, um, just the whole notion of making decisions for ourselves and making decisions on behalf of our children or minors in our care, etc. So that was the focus of our work last week, really. Our writing assignment, I haven't had a chance to take a look at it yet, but hopefully you did okay with that. And then also our discussion of the Terry Schiavo case. So that and our quiz, and that was it for last week. So let's take a look over at our quiz, a few of our quiz questions. So first question, although hospitals are not generally responsible for informing patients as to the risk, benefits, and alternatives to specific procedures, hospitals what? So our correct answer was, in some cases, owe a duty to provide patients with informed consent. So what we're getting at here is, think of a situation where let's say you have a patient coming in for a CT scan. So they're coming in for their CT scan, but they're going to have contrast with that. So it makes it a bit more invasive than just an imaging procedure. You'll have to have an IV. They'll have to inject the contrast, which can itself be problematic if you react to it, or if for some reason it isn't in line with maybe other medications you're taking, whatever. So it's important that we provide patients with informed consent in those settings so that they can make an informed decision as to whether they want to proceed or not. So in those cases, that is when we would see hospitals providing informed consent, because the hospital is the one doing the procedure. When we have a patient that might come in for surgery, for example, so we have a patient coming into the hospital for surgery, in that case, the surgeon will do the informed consent. The hospital does not need to do another additional informed consent. Typically, a hospital will already have on file a consent to treat, which is just a general consent that you allow the hospital or facility to provide treatment to you, not specific to any individual case. So they will have that, but for a surgical procedure, the informed consent would be done by the physician, because they're the ones that will be performing the procedure and are also the one that are the most knowledgeable and can provide you with insight. But in a case like this, like the CT scan that I mentioned, it's the hospital that's performing the procedure and injecting the contrast. So it would be the hospital it would be their duty to do that informed consent. Next question. The blank strives to provide viable alternatives that will lead to the optimal resolution of many difficult dilemmas facing patients, including end-of-life issues. So last week, remember, we talked about the ethics committees. Ethics committees exist within healthcare organizations to fulfill this role. I myself served on an ethics committee when I was a compliance officer, and our role was to help families and help the institution in cases where maybe someone that was within our care was a ward of the state. So it was really the role of the ethics committee to help to make those decisions, to help families make difficult decisions. Ethics committees will always have an ethicist, so they'll have someone that's a professional in ethics on the committee. They'll have several representatives of the administrative side of the operation. They'll have several representatives of the clinical side, and then they'll also have community members. So there will always be at least one community member as part of the ethics committee to give kind of the layperson view. Our ethics committee actually had 2 different community members. So it's a diverse group of background, different types of backgrounds, different approach to ethics, and then always one person that is expert in the theoretical side of ethics. So important committee. Things like the medical board, that's typically at the state level, governs licensure, medical licensure, and then the other 2 committees those are not necessarily things that would be involved in life and death issues. So ethics committee is what we're looking for there. If a patient has been informed that without a blood transfusion she will die, she refuses the blood, and the court orders the transfusion, the order is wrong based on the patient's right to what? So the correct answer is self-determination. So in this country, we have, as long as we are competent, We have a right to self-determine our care. It's also known as autonomy. So we have the ability to make decisions on our own. Now, sometimes we become incapacitated and incapable of making decisions. Maybe we've lost the capacity to consent due to age, due to an illness, or even in some situations, maybe it's just an emergency situation, patient's unconscious, doesn't have the capacity to consent. But generally, we always have the right to the right to self-determination or the right to autonomy, meaning that we get to make the choices about our care. Nobody else does. So that's crucial in the realm of the discussion of autonomy. So that's it for our quiz questions. Let's take a look at week 6. So in week 6, we're going to kind of roll back over to legal talk. We're going to talk a little bit about False Claims Act. We're going to talk about Stark Law, anti-kickback. So some of the more specific, detailed rules that we deal with, laws that we deal with in the healthcare sector. And then there are these 2 videos. One's about kickback, one's about Stark. They're a little on the dry side. They did come from the Office of Inspector General, but it'll give you a good reading things about Stark and any kickback can be it can make things confusing. I think that these are both pretty good videos that talk about those rules. We do have a written discussion board this week, and what I want you to do is take a recent article about a fraud or abuse case. So please try and stick within the last 5 years. Goodness knows that there is sadly a massive wealth of them out there in the last 5 years. But you want to be looking for a False Claims Act case, anti-kickback case, or a Stark case, which is also known as the Physician Self-Referral Law. And take a look at the case, give us a little summary. But then also talk about, could it have been prevented? How do you think it could have been prevented? Could it not have been prevented, etc.? Please stick within the healthcare setting. These rules, the False Claims Act and the anti-kickback statute apply outside of healthcare. The Physician Self-Referral Law doesn't, but those do apply outside of healthcare. So please choose a healthcare example so we can stay on track for the overall concept of the class. We also have a written assignment for an infographic. So if you haven't used infographics in the past, and this is the first class in this program, so well, actually, no, you probably have done these in the past. So if you haven't done them in the past, then this will be something new for you. But so these are just a few companies that offer some infographic, the ability to do infographics easily. Venngage, Pictochart. Some of them, well, actually, it's Venngage. If you use Venngage, they won't allow you to download the file, but what they do is allow you to share your file to the community page, and then you can provide a link to me to that file. So depending on which one of these things you use to create your infographic, there's some that allow you to download a low quality file. That's fine. Venngage will make you upload it to the community. That's fine. As long as I can see it in the long run, it's fine with me. So infographics are really a one-page pictorial representation of info. So I know that at least one of our other faculty members in this program does what she calls an infographic and has you create a lengthy document detailing graphically information over the class. This is a true infographic. So actually here, I'll show you one quick so you know what I'm talking about. I did just recently have some confusion with that assignments that other faculty member did. So I don't want you to have that type of confusion. So here's a Venngage one. This is one that I often see students use. They actually have templates out there, so you can get a template and just fill in information. And so this is what an infographic looks like, or this is what an infographic looks like. You share information on it, but you do it in a pictorial format. It's not a multi-page document. The one thing that you do need to do, sorry, we have a visitor. The one thing that you do need to do is make sure that you cite your sources at the bottom. So you don't need to do it within the document up here. You're usually just sharing a small amount of information, but please make sure that you do list at the bottom of the document any resources that you have used to create the document overall. So that's an important piece. So we have our infographic, the quiz, and the SED puzzle. So I think that's about it. If you have any questions, let me know, but otherwise I will look forward to seeing the cases that you choose for the discussion board. Okay, thanks a lot.